Hi everyone, it's me, Dr. Cheok from Rene Clinic. So in this episode, we are going to talk about non-surgical facelifting, the different modalities of non-surgical facelifting, the pros and cons on each type of modalities, as well as how do they actually work, and the downtime of each type of facelifting, as well as how often do we need to do it actually. So before we move on, I would like to show you this graph, which is the collagen retention rate graph of human being. So you can see at the age of 20, the collagen counts actually starts to deteriorate. And at the age of 40 to 50 years old, it has already deteriorated about 50%. So the golden number to start to maintain your own collagen is at the age of 20 years old and to slow down the rate of deterioration. So as you can imagine, at 50 years old, you probably have to spend more to retain your collagen or boost up your collagen. Before we start into the different modalities, I would like to show you the difference between the young and the old phase. And they actually have, because of this mask layer, the loosening collagen of this mask layer in elderly causes sagging on our face. What is mask layer is actually a plastic layer or elastic layer under our face that suspend the whole face. So in losing collagen in this layer causes sagging in our face. And what are the different types of non-surgical facelifting is that I have categorized it into 4 categories. The first category is what we call microfocal ultrasound or the Ultherapy treatment. The second is the HIFU treatment. The third is the radio frequency devices. The fourth category is the thread lifting treatment. So how does all this work is microfocal ultrasound is by focal ultrasound targeting underneath your skin, creating what we call thermal coagulation point, which in turn cause increased elasticity in this mask layer. The HIFU is a counterfeit, not to say counterfeit, it's a copycat machine of microfocal ultrasound that tries to imitate the technology of microfocal ultrasound. So the third treatment is what we call radio frequency devices. These devices create random bulk heating, which in turn cause collagen contraction and increase collagen count. And the fourth is thread lifting. This treatment causes some tension force to lift up the mask layer of the face, and it also causes some collagen production underneath the skin. So in terms of downtime, what are the differences in between them is that microfocal ultrasound has 0 downtime because it bypasses your skin and creates the microfocal ultrasound under your skin. HIFU, I put a question mark here because there are variables downtime. Some of the machine creates a lot of heat and a lot of damages that creates some ulcer as well as views. Radio frequency devices do not give you any downtime because they create bulk heating and some collagen. Thread lifting has some downtime of 7 to 14 days. It's because when you insert the threads, you have some skin needle point insertion as well as some dimpling and uneven skin because of the tension caused. What are the results like is the results in microfocal ultrasound for Ultherapy is quite consistent and is FDA approved. The results for HIFU is quite variable depending on how good they copy the technology from Ultherapy. And radio frequency devices, the results are variable as well, depending on which type of machines and how much heat has generated from the radio frequency device. Thread lifting's results are variable because the aftercare is a very important part for this kind of treatment. If one does not take care of the aftercare, it may probably have no result to minimal result. So it's variable as well. How about how frequent do we do this treatment? Is that Ultherapy you only need to do once in a year, and the treatment result can actually last for 12 to 18 months. For HIFU is quite variable. It's because depending as well how good is the technology being copied from Ultherapy. And most machines recommended once in 6 months for HIFU machine. For radiofrequency devices, you probably need to do every 1 to 2 weeks to get notifiable, satisfiable result. For thread lifting, in my experience, you probably need to do every 6 to 12 months to get good results. In safety wise, the Ultherapy microfocal ultrasound is US FDA approved, not because it's very consistent, and it also has this what we call deep sea technology to visualize the treatment being performed, and we can actually visualize what has been where is the shots being delivered, as well as accurately placing the shots to the layer that we want. Whereas in these HIFU OEM machines, the shots are being placed blindly. And what are the difference between Ultherapy and the HIFU machines is that the shots being placed are sometimes not consistent. As you can see here on the right, the shots are not consistent, and out of so many shots, it is only deliver one shots. As you can see, is on the left is the authentic Ultherapy machine has delivered consistent shots. As well as you can see here, on the left is the shots being delivered by Ultherapy system. It's very accurately delivered at the 4.5 mm layer, whereas on the right is a competitor OEM machines that deliver the shots at variable depths, as well as it also has misfirings. Because Ultherapy is so effective and it has zero downtimes, it's being copied counterfeit as well. In this slide, you can see on the left is the original machine, and on the right is counterfeit products that looks the same from top to toe, but it has altogether a different technology. Most of them has no shots being fired, but some radiofrequency devices. So how do we make sure that we are getting the real Ultherapy treatment? Is that you must make sure it's being done by a certified doctor. And in that center, you probably need to find out these three identities, which is the stickers, the crystal, as well as this authentic sticker on the machine itself. So next, we will also show you the demonstration on how we actually perform the Ultherapy treatment on one of the artists in Malaysia.